Hi everyone, it's Lorelei here. This week I would like to start a new segment on my YouTube channel entitled News and Views in Mental Health. This news would include stories making headlines across Canada, the United States, and internationally. Twice a week I will be bringing you up to date on what's making news and events happening in mental health. If at any time you feel like sharing your views or comments on a particular story covered, please feel free to do so. So let's get started on the news for this week. Under pressure, first responders urged to reach out for mental health support. As British Columbia first responders continue to battle two simultaneous public health emergencies, one of their own is reminding his colleagues in the field that mental health help is only a click away. Matt Johnston is a Lower Mainland firefighter, a registered clinical counselor, and the co-founder of First Responder Health, which is an educational company specializing in training healthcare providers on how to work with public safety personnel experiencing mental health issues. By accessing the company's website, first responders can connect with a directory of specially trained mental health professionals across the province. The directory is open to the public, meaning partners and children of first responders can also access the resource. With the stress of the opioid crisis and the COVID-19 pandemic taking its toll on BC, first responders Johnston hopes those suffering from the stresses of the job will reach out. First responders from all fields are twice as likely to experience post-traumatic stress disorder than other Canadians, according to the Centre for Suicide Prevention. The suicide rate among paramedics, according to Statistics Canada, is 5 times higher than the national average of 11.3 deaths per 100,000 people. Johnston says the BC government has to step up with more support for first responders. It's a pandemic, and if the trend of suicides across public safety personnel doesn't do it, I'm not sure what needs to be in place for that to happen, Johnston told CBC's The Early Edition on Wednesday last week. Clinicians listed on the website were immersed in training classrooms to understand the pressures and culture of first responders. For example, in a 1-2-day seminar, the clinicians would listen in to the calls coming in on the speakers in a fire hall. First responders are trained in a stoic paramilitary work system that many civilian healthcare providers have no idea how to deal with, said Johnston. That's a major gap that I really hope the province of BC can address in the coming years. To access mental health resources for BC, first responders can visit firstresponderhealth.org. Kids back at school in person. This mental health expert has some tips. Students at all 4 of Ottawa's school boards are back to in-person classes as of last Thursday. And for some, it's their first time in more than a year. For some, the COVID-19 school closures meant the loss of structure, community, and the added stress that comes with that. But returning to school can be stressful too, especially with the additional pandemic safety protocols. Discussions about back to school could happen in the car while driving or during a game of basketball. She says to avoid a big talk that adds stress for everyone. The idea of the conversation is to make space for the breadth of emotions students may feel, especially as things could shift as the school year goes on. I think as adults, we often actually really rush to fix and solve things and tell our children all the information, but the reality is right now we don't have all the answers. It is also important to understand that everyone is going to be feeling a lot of things, and not all of them will be negative, she says. We talk a lot about the nerves, but we know that some students are really going to thrive with the return, Bella said. For others, it'll be a struggle. Kids might not always be able to articulate all they're feeling, Bala said. She suggests watching for behavioral changes. Anxious feelings can manifest as withdrawal, shutting down, or acting out. While there's a tendency to see acting out as intentional, Bala says, it can be an indication of anxiety. If the adults in a student's life can model calmness, that will also help, Bala says, as will parents' belief that their kid can go with the flow and manage the changes as they come. For kids starting kindergarten or older kids adjusting to new routines, it's not their age as much as their temperament, she said. In the face of uncertainty of what the Delta variant will mean for schools, Bala suggests the whole family focus on what is known and what can be controlled. Take what your children experienced last year, then talk about what worked and didn't work for them. Ask if they want to walk to school by themselves, with parents or with friends. It's important setting a routine that will help students prepare for their school schedule, as can adjustments to the amount of screen time and introducing them to a larger group of peers with physically distanced park visits. Since masks are a guarantee, talk about those. All Ottawa school boards have mandated masks for students from kindergarten to grade 12. On CBC's Ottawa Morning, Dr. Vera Etches, the city's medical officer of health, says 3-layer masks do make a difference. Etches said all the COVID-19 protocols from cleaning to masks to distancing help reduce the risk of the Delta variant. She said the largest protection is parents and eligible students getting vaccinated. Manitoba Education Minister announces $1 million in mental health supports. The province is spending more than $1 million in additional education mental health supports. Manitoba Education Minister Cliff Cullen announced last Tuesday. The money will fund what the province is calling a continuum of mental health supports for students, teachers, and staff, including $380,000 to the Canadian Mental Health Association to provide support to the education workforce, $40,000 to provide safe talk training and resources based around suicide prevention and intervention for 50 teachers, and $150,000 TOE pilot projects that engage local elders and knowledge keepers in schools. Other funding will allow for expansion of the Sources of Strength program, as well as professional development to address long-term trauma related to the pandemic. The impacts of the pandemic are far-reaching and continue to be a critical issue for schools, families, and communities as students return to school this fall, said Cullen. Maritime children in crisis amid pandemic, experts say. A recently released report by Children First Canada reports children's rights have been violated during the pandemic. Experts in the Maritimes say action is needed. The report paints a frightening picture of what children all across the country are facing, issues that have only intensified over the course of the pandemic. Some of the threats listed in the report are food insecurity, mental health, child abuse, systemic racism, and poverty. Sarah Austin is the founder and CEO of Children First Canada, and she believes the government and society have failed children in a colossal way. Kids have made enormous sacrifices throughout the pandemic to protect their elders and keep our communities safe. They gave up school, birthday parties, sports, and so much more, she told Global News from her office in Calgary. When it came time for us as adults to do our part for children, sadly, as a society, we have failed them. In spite of the overwhelming evidence that the kids are not all right and that the kids are in a state of crisis, so little has been done. With the federal election around the corner, Austin says she is appalled that political parties have largely ignored children's issues. It's something that keeps her up at night. Quite crassly, one of the factors in this is that kids can't vote. Kids aren't decision makers when it comes to electing our officials, and so it can't be quite easy to discount these issues, she said. Nova Scotia is currently the only province in Atlantic Canada that doesn't have a child and youth advocate position in government. However, the newly appointed Minister of Community Services, Carla McFarlane, is adamant about moving forward with this. In the cabinet meeting on last Thursday, she said she thought having the position was important as it gives youth a say. It gives them a voice and a connection directly to government and shows that we care and that we want to listen to concerns that they have. Child psychologist Dr. Jill Chorney, who works at the IWK Health Centre, echoes the importance of the role. Children and youth have voices, and their voices need to be heard and considered in how we're making decisions going forward. We're doing a lot to try and engage youth and families in making decisions about their care, she said. It's important we engage youth and children in how we run our services as well. According to the report, over the past decade, Canada has fallen from 10th place to 30th among affluent counties for childhood well-being, yet there remains a persistent myth that Canada is one of the best places in the world to raise a child. Almost 1 in 5 Canadian children lives in poverty, which has been exacerbated by the pandemic. Alex Stratford is the Executive Director and Registrar for the Nova Scotia College for Social Workers. He told Global News that Nova Scotia has one of the lowest rates of income assistance, as well as one of the lowest wages in the country, thus leading to food insecurity. We have very few food policies in Nova Scotia. When food banks came into play in the 80s and 90s, they were meant to be a stopgap measure. They were meant to be for emergency use, and we would build social policy to help alleviate that issue, he said. They have now become a staple in how folks access food. They are very stigmatizing. Minister McFarlane said the child poverty rates in Nova Scotia are very concerning and said it was her #1 priority to reduce child poverty levels. Just a reminder that if you know of anyone who is struggling emotionally, I am here to help and support. As always, thanks so much for watching this first issue of News and Views, and I will talk to you again real soon. Take care.